So this is the story of my last 7 days in third year BPTH and how I spent hours and hours just reading and reading. So if you have been following, we have total 6 subjects in third year, that is Surgery 1, Surgery 2, Medicine 1, Medicine 2, FDPS and lastly PSM, plus 2 internal subjects, that is Obs and Gynae and Dermatology. So the story starts 7 days back where I decided to conquer all the subjects. What you actually require to conquer a subject is determination and practice. Now if you're wondering what surgery 1 is any kind of surgical procedure which is performed inside the body for altering the structures of the human body by incision, or it might be a medicine diagnostic purpose to check the organs inside the body. Let me give you an example of varicose veins, in which veins become dilated, elongated and tortuous. So the tests which are performed by the examiners are Brody-Strendelberg test, Oniquet test and Pratt's test. Now the surgical interventions which are performed for varicose veins treatment are crossectomy, stab avulsions of varicose veins and perforators, and also ligations. There are plenty of conditions, diseases which we study in surgery like carditis, myocardial infarction, Burgess disease, hernia, DVT, that is deep vein thrombosis, and basically the importance of this subject is to know the type of surgery which is performed for a particular condition. Okay, so on first day it took me 9 hours just to read surgery 1 and solidify my weak points. Once I was done reading surgery 1, I had to plan out how my next 6 days are going to look like, because eventually after next 6 days I had to appear for my final exams. Here is the timetable. See, you have 6 subjects. Now you need to mainly focus on the middle 4 subjects, because for the first subject you will start beforehand, and for the last subject you will be very motivated because it will be a last paper, and after that you will go home, you will enjoy. Now here's what medicine 1 deals with. In medicine 1 we have bunch of diseases of cardiovascular systems like chronic heart disease, rheumatic heart diseases, cardiomyopathy, cardiac tamponade, and some endocrine diseases as well like Cushing syndromes, diabetes mellitus, diabetic neuropathy, retinopathy and much more. We also have some bone related diseases like ankylosing spondylitis, osteomyelitis. Main focus of this subject is on the medicines and the drugs that we give to the patients, okay, and its clinical features. Initially I covered all the PYQs. Then I went on to the syllabus and completed the topics which were remaining, and then started the revision part. Okay, so now the questions many of you will ask me is, can we complete the syllabus in 1 day or just 1 week before the exam? The habit of mine which has greatly helped me is studying from the start and covering all the topics, because if you are just studying for passing purpose, you might read all the important questions and give the exam and pass that exam. But if you are reading for the knowledge purpose, you need to give specific amount of time to specific subjects to understand the subject, understand the basics. Okay, now coming towards surgery 2, what the surgery 2 actually deals with is orthopedics, bones and tumors. Okay, let me give an example of scoliosis, which is the lateral curvature of the spine, which may be present by birth or because of faulty postures or say any traumatic condition. Spine curves exceeds more than 60 to 70 degree, you might need the surgery. But if the scoliosis is because of faulty posture, it might be treated with the help of some braces. Now say if there is a case of fracture of neck of femur or shaft of the femur, then what all surgeries will be performed, like say external fixation will include ring fixator, internal fixation it will include open reduction internal fixation like plating with screws and intramedullary nailing, or say total hip replacement, arthroplasty, hemiarthroplasty. So all these surgeries which are performed related to any of the bones or say tumors or say any other conditions like soft tissue injuries like bursitis, synovitis. This is all included in surgery 2. My day was filled with fun and joy because I was out of the trauma of medicine 1. And the reason you're not seeing a lot of footage is because I was busy studying surgery 2 and I did not shoot much. Now the next day came and I had to study medicine 2. Talking about medicine 2, it is divided into 2 parts, that is neurology and pediatrics. In neurology we study all the conditions, diseases related to the brain, that is cerebrum, basal ganglia. Like for example, in basal ganglia we'll study Parkinsonism, dystonia, chorias, acistosis, some conditions of spinal cord lesion, that is spinal cord injury, bladder dysfunction, some anterior horn diseases like syringomyelia, poliomyelitis, and some infections like meningitis, HIV, encephalitis. Now coming towards the pediatrics, here we study all the developmental milestones of a child, if there is any defect in the developmental milestones, and some of the infections which occur in the neonates or infants like meningocele, meningomyelocele, hydrocephalus. We have to study all these conditions, clinical features related to it, signs, symptoms, and some medicines which could be given to cure the diseases. Now the next morning came and I had to study our internal subject and complete it thoroughly, that is FDPS, Functional Diagnosis of Physiotherapeutic Skills. This is the actual stepping stone in understanding the actual concept of physiotherapy assessment. It includes cardiorespiratory, musculoskeletal and neurological assessment in order to understand the impairments that takes place because of the particular conditions and which causes an impact on activity and participation of an individual. Really very difficult to cover such a huge subject in a single day. Ortho includes all the special tests of all the joints starting from shoulder. Next are the mobilization techniques like Maitland's, Mulligan, Kaltenborn. Next, coming to cardiorespiratory, for evaluation of functional capacity, 6-minute walk test. It is the favorite question of यूनिवर्सिटी से, हमको ये साल भी आया था वो क्वेश्चन. नेक्स्ट इज ETT, दैट इज एक्सरसाइज टॉलरेंस टेस्ट, ब्रूस प्रोटोकॉल, मॉडिफाइड ब्रूस प्रोटोकॉल. नेक्स्ट कमिंग टू न्यूरो, इन दैट वी हैव टू स्टडी द स्केल्स लाइक मॉडिफाइड एशवर्थ स्केल, एशिया स्केल फॉर स्पाइनल कॉर्ड इंजरी, GCS scale which is the most important scale for ICU के patients में वो लेना ही है. Some therapeutic techniques like PNF, Roots approach, NDT, some electrodiagnostic techniques like SD curve, EMG, NCV, and there is some part of second year also which you have to study. Need not worry, in the back of your mind वो आपके दिमाग में कहीं ना कहीं तो रहेगा ही, और अगर आपने पढ़ा नहीं होगा एग्जाम में आ गया, you will be able to write something if you have studied it in your second. अभी आपने कुछ टॉपिक्स पढ़े हैं, so you need to understand that जो भी टॉपिक्स आपने पढ़े हैं उससे एग्ज़ाम से 1 या 2 दिन पहले आपको वो सारे टॉपिक्स फिर से रिविजन करने ही होंगे. सो मेक श्योर यू स्टडी उतने ही टॉपिक्स जितने यू विल बी एबल टू रिवाइज. आप जो एग्ज़ाम से 1-2 दिन पहले पढ़ते हो, दैट गोज़ इन टू योर शॉर्ट टर्म मेमोरी, एंड आपकी लॉन्ग टर्म मेमोरी में जो आपने 1-2 महीने पहले या बहुत पहले पढ़ा हुआ है वो चीज़ें रहेंगी. फॉर मी personally, I don't recommend studying any new topics before 1 or 2 days before the exams, because it will lead to more anxiety, you will be panicked. Instead of studying new topics, just focus on the topics which you have studied beforehand. Most importantly, sleep. It differs from person to person. Some people like me, I sleep for 5 to 6 hours anyhow, because you are going to appear for your university exams, and for me personally, I need to give rest to my brain for some time. But there are also people who do not sleep, just take rest of 2 to 3 hours. It differs from person to person, but personally me, I recommend to take rest of at least 5 to 6 hours. Now coming towards the diet, I can't stay without eating junk food or street food at any single day, but in the month of December, I promised myself that I won't eat any outside food for whole month. Make sure your diet is proper. Do not eat any junk food for 1 month, because if your health is not supporting you, you won't be able to focus, concentrate and write your paper. So stay calm. There is no need to panic. वो कोई और टॉपिक पढ़ रहे हैं या आपने वो टॉपिक पढ़ा नहीं है, need not worry. You know everything, and if any question comes out of the box that you have not studied, you will know something related to that. Just write any points which you find relatable to that question. Also, what I did was I wrote down the topics which I have to read, started to read one by one, and I ticked the topics which I have covered, which I have revised. So it gave me a kind of motivation कि इतना ही अभी पढ़ना है, इतना ही बाकी है, and फिर इतना ही रिवाइज करना है. Now coming towards our last paper, that is PSM, Community Health and Sociology. So basically ये subject ऐसा है जिसमें सभी को लगता है कि हमें ठोक के आना है, but it is the very vast subject of third year, and personally I have studied this subject from the start of the year. मैंने बाकी सब्जेक्ट्स पे इतना ध्यान नहीं दिया, बट आई स्टडीड PSM बिकॉज आई न्यू, जो के पार्क की बुक है, इतनी बड़ी बुक है वो, और प्लस सोशियोलॉजी की सचदेवा करके एक बुक है, वो हमें पढ़नी होती है. बट स्टिल क्वेश्चंस विच वर आस्क्ड इन द पेपर वेर समथिंग डिफरेंट, लाइक टोटली अनएक्सपेक्टेड क्वेश्चंस थे. सो make sure you study PSM from the start and do not take it lightly, because national programs and some communicable non-communicable diseases, sociology के कोई acts, theories, social crimes like dowry, child labor. Just we think कि हाँ हम ठोक देंगे but ठोकने के लिए you need to know the basics, right? So वो basics ही आप starting से पढ़ना, एंड मूवमेंट पे आप पैनिक हो जाओगे, आपको कुछ समझ भी नहीं आएगा. सो मेक श्योर यू स्टडी इट फ्रॉम द स्टार्ट. या 2 घंटे मिनिमम निकाल के यू कैन जस्ट गिव फॉर द सब्जेक्ट बिकॉज इट इज़ अ वेरी वास्ट सब्जेक्ट. वन मोर अपडेट दैट I have to give you is from this year, MUHS has made a rule that you have to write with black ball pen in your exams. No blue ball pen is allowed. So make sure you carry your black ball pen with you in exams. Make sure to read the guidelines given in the hall ticket, and also in the answer sheet which they provide during the exams. They have clearly mentioned not to draw a line in your answer sheet because already space कम होती है, उसमें भी आप line draw करोगे तो space और reduce हो जाएगी. So do read the guidelines in the answer sheet. No extra answer sheet is provided in university exams, as you all know. ये छोटी छोटी चीज़ें हैं जो ध्यान रखना. People want कि हमें आंसर कैसे लिखना है, what should be the answer pattern of particular subjects, then do let me know in the comments so that I can make a new video on it. Yes, I'm ending this video here. If you all enjoyed my exam week, then do subscribe to the channel, share it with your friends. This video has motivated you and also you got an idea of medical students' life looks like. Make sure to subscribe to the channel as it is very free of cost. So thank you for watching. I will catch you in the next video. Till then, bye, take care.
Damn.